Okay, so the webcast has started.
Thank you, Emma. Right, good afternoon and welcome everyone. Emma, can I turn to you to deal with the outside appointment now?
Thank you, Councillor Fairhurst. Yes, this is just a procedural item. It's to make formal an appointment to an outside body, which has been in place for some time informally, but it's just to appoint Councillor Heron into the role as a formal arrangement.
Yeah, and I think, yeah, and I thoroughly approve. He has been doing the role. It's in his patch. He should just carry on doing it. Yeah.
Okay. Thank you.
Thank you very much. Right, now if we move on to the main body of the report. Jason, do you want to talk us through it all?
Yeah, thank you, Councillor Fairhurst. You'll notice from the paper there's quite a lot of sort of fairly technical information in there, so I'm going to try and distill that into 5 or 6 key points, if you like, which will hopefully support you to make a decision. So, in terms of our recommendations, we're seeking permission for 3 things essentially. So, firstly, we're looking for permission to spend up to 25.5 million of contingent spend to renew and expand some existing nomination and void agreements that we already have in place. Then we're looking for up to £40 million of contingent spend for future nomination and void agreements for schemes that are as yet undetermined. So these are some way into the future potentially. And then thirdly, we're looking for sort of permission for you to delegate a degree of authority to Graham to look at the schemes individually as they come through for approval, obviously in consultation with you as required. So those are the three strands that we're looking for. To summarise the paper, so firstly, just to state, obviously, supported accommodation, supported living is and remains a key strategic aim for the County Council and for adults' health and care particularly. So for a number of reasons, this is our preferred option for long-term care and support for people with disabilities and mental health issues. So for the council, it still provides generally a better value option than residential care in terms of the money that we spend. And that's because in supported accommodation, we only pay for the direct provision of care, whereas in residential care, we pay for everything as part of that inclusive price. So we pay for the care, the housing, the food, everything is part of that fee. So supported accommodation in most cases is the better value option for the council in terms of our budget. And then also for individuals, there are a range of benefits. So the security of tenure from having a tenancy and the legal rights that confers on people is really important. It gives people a lot more security and is counted as settled accommodation as opposed to residential care, which is less secure for people. Most people in supported accommodation also have better access to benefits. They're generally financially better off, which expands their options, obviously, in terms of their hobbies and interests and their quality of life. And people generally have they have more choice and control over their lives. So in supported accommodation, there is a very clear separation between the care function and the housing function. So people can change their care arrangements without jeopardising their housing arrangements. So they have that choice and control. And that's not the case in residential care, where, again, things are very much kind of tied together. So for those reasons, supported living and supported accommodation, is something that we really, really want to expand and improve on. We've got a really good track record. We've developed lots of stuff. We've invested lots of capital, but we want to continue that journey to make this option open to as many people as possible. So whilst supported accommodation is a good option for the council and a great option for service users, it can be less attractive for landlords, and this is the nub of this conversation. So because of the nature of the schemes, quite often these are shared houses, or they're blocks of flats where people live in quite close proximity. The council needs and wants to retain a really, really high degree of control over the people who live in these schemes. So because we're paying for the care and because of those compatibility issues, we are the only people who we can really put people forward for any units or beds that become void in these schemes. So the landlords are essentially completely dependent on the council to put people forward for the schemes. So they can't just kind of pull people in off the general needs housing list, or through whatever list they maintain. So that's quite an unusual setup for the landlords to be that dependent on us. The nature of the people that we work with means that the lead-in time to move people into these schemes can be excessive, or not excessive, but can be quite lengthy. So whereas in general needs, I think landlords would be looking to turn around, if a house becomes available through a general needs scheme, they'd be looking to fill that house within days, certainly within weeks, such as the demand for housing. Because of the needs of the people that we work with, and the length of time it can take to work through things like mental capacity, all of those compatibility issues, the training that the care provider needs, the involvement of families, the court of protection, all of those things can mean it can take many months for moves to happen, even with a fair wind. And all the time that those beds and those units are void, the landlord is losing income on that, and their financial models are built around a fairly high level of occupancy, so that quickly becomes unsustainable. And then additionally, the provision of supported housing is just generally more expensive for the landlords to operate. The wear and tear on the properties, the needs of the people that we work with, obviously very, very complex needs, can have an impact on the built environment. There may be a requirement for housing officers to become more involved in those schemes. People will generally need letters translated into easy read and those types of things. So just doing all those things is a financial burden on the landlord. So we need to incentivize them and to remove some of those blockers to keep them working with us. The next point I'd like to make is just around the future for supported accommodation. So over the last 5 years, we've had fantastic support from the county council and have invested significant capital to build from the ground up over 100 new supported living flats, generally blocks of flats, which has been fantastic. The capital that we have available is going to be less in the future. There is still some significant capital available, but it's going to be very much reserved for those with the most complex needs. So to fulfill our strategic objectives, to make these options open to more people, we're going to have to leverage and expand our relationships with partners, with the big housing partners, with developers, to give us other options which aren't dependent on the council building things from the ground up, which has become a very, very expensive thing to do, particularly post-COVID. So these nomination and void agreements are part of that offer from the council, part of that partnership with the landlords, with the housing providers, with the developers, to signal our commitment and to protect them from some of those financial risks which I've talked about. We do have a range of things in place which minimise our exposure. So the amounts of money that I've spoken about are what we call contingent liability. So that is the kind of worst case scenario. If you imagine a 6-bed house, if all 6 beds were empty for the whole duration of the agreement, that's the contingent liability. That in reality that doesn't happen, because we work really, really hard to get those voids filled, and we have a dedicated team, a supported accommodation team, whose sole focus is on doing that. So we have a very centralised process now, strategic process, where we have a very, very detailed list of people who are looking for accommodation. We have really, really good insights into where the voids are, and that team are constantly marrying those two lists up and filling those voids as quickly as possible. So that happens at a very, very strategic level, which is really good. So also to point out, the money, the sums that we're requesting are not new money. We're not asking for additional investment from the council. For the existing schemes, we already have a number of agreements in place, and the spend on those is already built into the budget. And then for the future schemes, we would essentially be recycling savings, from moving people from residential care. The provision of the void agreement would be part of the savings equation, as we move through that work. So we're not requesting new money from the council. In terms of the kind of background context and the sort of reasoning behind the permission, that's probably as much as I need to give. There's layers of detail in the paper, which you may have questions about, but I'm happy to take any questions.
Right, no, that's fine, Jason. I'm very happy with the voids for the existing providers. The money we're setting aside for future providers. What's the appetite among residential homeowners to convert to supported living? I mean, from our point of view, it's great. I'm not sure how they're feeling about it.
So there's a couple of different approaches to that, Councillor Fairhurst, essentially. So there is an option for care home owners to deregister their properties. And we have a register called something called the Hampshire Deregistration Partnership Register, which was subject to a separate permission a couple of months ago. So homeowners can register on there if they're interested in deregistering to supported living. And there are some criteria that we request there. So we have seen significant movement in the market. I think the market, particularly the big national providers, they understand that we mean what we say. Now, you know, when we say that supported living is our preferred option, and we have seen huge movement on one or two who have been resistant previously to that, who are now very much on board. So that's a slightly separate route to supported living. We are also kind of working at a more individual level, where we will kind of work with providers to move individual people out of care homes into new schemes, and that's the other route. And again, I think providers who have the right kind of ethical background and have the right morals and you know, are in it for the right reasons will support that, because it's the individual is on a journey towards sort of more independence. We do see some resistance now and again, but we work with providers individually where required on that.
Okay. We have built some fantastic things for supported living, and I think any younger adult who gets into one of our places can would count themselves fortunate. Do any of the big providers, are any of them looking at building similar new schemes, or is it all about converting existing homes?
New build may be an option in the future. What we do say to the market is that we will tell them when we want that and where we want it. So we try and discourage providers from just building stuff unilaterally, because that brings a whole range of contractual and procurement issues, and you know, is it in the right place and have they got the design right? So we use our procurement frameworks to be really clear to the market when we want something, and a new build might be an option for a provider if they see you know, the longevity of the agreements and a potential return on that. I wouldn't discount it, but I think, as I mentioned, the unit cost for new builds has become very, very high. It's almost doubled in the last sort of 2 or 3 years. So the sums might not be quite as attractive in the future, would be my guess.
Okay. Right. Councillor Carpenter, have you any questions?
Not really, Jason. You said that it's not new money. Is it more costly for the council in the initial stages of doing this?
If there's a brand new scheme, and that could be there could be a situation where we have a void agreement in a brand new scheme, something that's been repurposed or converted or new build, then there would generally be there'd be higher voids in that initial period whilst that scheme fills up. But over the lifetime of a scheme, the savings that we gain from supported living as opposed to residential care will generally always give us better value. And it will depend, exactly what that looks like will depend on the scheme and who's living there. But at a strategic level, supported living is the more cost-effective option for us.
Okay, thank you.
As well as being better for the person.
Absolutely.
Yeah. Okay. Councillor Withers.
No, I'm in total support of supported living and accommodation. I think it's very wise. I think like the deregistered care homes, you know, it's meeting an individual's needs, and especially allowing them to get benefits which they can use to improve the standard of their life. I am aware, as you're aware, that we are getting more people that require supported accommodation living. And, you know, I've got an individual over at Trelora's in the Crescent there who's coming to the end of his tenure that wants to be with his mates and wants to be, you know, partially supported, but not totally supported. But unfortunately, a lot of these individuals who've only got visualization as opposed and weak communication and writing skills do need support 24 hours a day, even though they don't necessarily want it. But we need to ensure that we've got the right accommodation to meet their needs and the staff to do it. So I think it's the recommendations are excellent. I think the movement of money from one area to the other, the cost of new bills, you know, when we look at Sonnet, the bungalows there we've just seen, which are excellent, but you know, we do need to take into account also that some of these individuals want to be near a town centre so that they can get in there and have a more sort of normal life. But as you say, the cost of actually providing that accommodation is getting more and more expensive. So I think, you know, we do an excellent job. The recommendations to continue what we're doing, but obviously we're all aware that mental health and special needs is growing all the time. And the local census that's just come out from 2021 is identifying, you know, so many people from the teenage age group up coming into adulthood, you know, requiring this facility. So fully endorse the recommendations.
Thank you. Dave, I do have to come to you. Are you happy about the money?
Thank you, Councillor Fairs. Yep, Jason and I have worked closely on this, and I'm perfectly happy with the position financially within this. Obviously, as Jason's already made clear, these are contingent liabilities based on previous experience. Obviously, the amount of voids we would pay are significantly lower than those contingent liabilities. And yes, Jason is also correct that the long-term saving and the annual recurring saving, as well as making benefits for the client, being beneficial for the clients, the financial saving that we make on an annual basis is significantly greater with a few void costs as opposed to paying for residential care. So I'm content. Thank you, Councillor Fairs.
Thank you. Graham, you wanted to talk about the opposition league members.
Yeah, thank you, Councillor Fairhurst. So along with Jason and with Jess and with Jenny Dixon, we met with opposition league members yesterday. So Councillors Harrison, Taylor and Tree. They were given a very extensive briefing on this proposal. They had lots of questions, but all questions were answered appropriately, and they didn't raise any particular objections at all in terms of the briefing and the paper before you today. Thank you.
Good. Right. Anything from anyone else, or is everyone happy that we go to the recommendations? And Jason, I more than approve. I think, you know, this is a good step forward, and hopefully we'll get more providers coming on board with the idea of supported living. Yeah.
Excellent.
Thank you.
Thank you.
Okay, thank you all, everyone. Nice to see you all. We'll see. I don't know. Will we see you? Oh, I'll see you on Thursday, won't I? Yeah. Okay.